Good morning, heart failure colleagues and friends. We are certainly living in unprecedented times. What started as a novel virus in China, we now know as coronavirus or COVID-19, with Medexium predicting that the number of cases will double every 7 to 10 days. I personally think this may end up being a little bit like 9/11, where we mark time by referring to things as pre-coronavirus and post-coronavirus, clearly showing you the impact of this pandemic on our daily lives. AAHFN recognizes that this is a personal and professional struggle for many of us as we serve on the front lines and in our communities to prepare for the potential surges ahead. Nurses remain on the front line of primary prevention, and I hope you continue with me in the mantra of social distancing and effective hand washing and cough etiquette, as well as avoiding touching the face. Many areas, including my own, have gone to universal masking as another protective measure in an attempt to flatten the curve. I wanted to spend just a few minutes and give you some updates from association headquarters and some of the things that's happening on the back end to support the members during this most difficult time. Number one, many of you have already realized that we had to postpone our Advanced Heart Failure Symposium that was to occur in Philadelphia in late March. Our new dates have been set for November 6th and 7th, with most of the speakers already confirming their availability. So that's an agenda that's packed full of complex topics, and I'm sure you won't want to miss that. Number two, we've extended our renewal deadlines for our CHFN and our CHFNK members. We know that worrying about certification renewal right now is not your top priority. Number three, we hope that you're keeping up with all the day-to-day and sometimes moment-to-moment data and research that's out there on controlling and managing COVID-19. Something very prudent for us is the statement that was made by HFSA, ACC, and the AHA, which recommended that we continue the use of ACE inhibitors and angiotensin receptor blockers in the heart failure population, despite a potential positive COVID status. So there was a lot of speculation about that, but currently the recommendation is to continue those neurohormonal blocking agents that we know have been so vital to improving outcomes. A few other quick things to tell you about is that Respicardia will be sponsoring a webinar on the important comorbid condition of sleep apnea. I think this will coincide with a Sleep Awareness Day, which will be occurring later in April, so more details to come. We will also be hosting a virtual conference about amyloidosis in the upcoming months. We know that this has been a big year for amyloidosis and heart failure with new therapies available, so this will be a focused webinar that the planning committee has worked long and hard on, so you won't want to miss that either. And lastly, I know that many of you are questioning what we're going to do about the annual meeting that is scheduled to occur in Boston in late June. And please know that the board of directors and AHFN puts nothing more higher priority than maintaining the safety of our members. So we're closely monitoring the CDC recommendations and the World Health Organization and their recommendations moving forward. At this time, our plans are to proceed, but knowing that this is changing moment to moment and some days, day by day. So stay tuned and we will keep you informed as these details continue to evolve. AHFN stands strong with you during the COVID-19 crisis, and I want to salute all the healthcare workers who are sacrificing their own personal well-being by providing care for those in need. So stay healthy, stay strong, and stay tuned. We'll keep you posted as we learn more and as we soldier on. Hope you have a great rest of the week. Thank you so much.